It's a real pleasure to be here at Life Science Innovation Northwest with Dr. Lee Huntsman, President Emeritus of the University of Washington, board member of the Washington Biotechnology and Biomedical Association, and a leading citizen of the life sciences community in the Pacific Northwest. Lee comes to these events, listens, learns, and shares his wisdom with one and all. And we're going to just benefit from a few moments of your time, Lee. Give us some observations about what seems exciting and interesting and impressive this year at the conference.
Well, this is such a dynamic conference, Jack. The attendance is strong, but the energy is what's really impressive. People are really into this. And if you look at the context of what we've been through in recent years with the restrictions on budgets and difficulty, it's amazing. The people who are determined to make the world of health better are unstoppable. They're just really fired up. And I'm impressed by the fact that is evident at very specific ideas, you know, the individual companies and researchers and some dynamite potential for making health better. I'm impressed by the level of energy that's evident in the interaction, people finding each other and new kinds of partnerships. But one of the things that interests me, and I'm very, very happy to see that's maybe a little different this year, is the attention being given to the big picture, the macroscopic forces that are reshaping healthcare. You know, Steve Burrell did a great job of describing that yesterday, and we've been talking about it here in Seattle for the last few years. But it's really hugely important. It's changing the whole healthcare ecosystem, and those of us that are focused on science and technology that can help healthcare be both better and more cost effective, this is a very dynamic season, and I'm really encouraged by the level of engagement of people with trying to make healthcare something different and much more cost effective.
Do you see connective tissue between some of those macro trends and some of the very focused technology innovations that are being talked about here?
I do. I see several kinds of connective tissue. One of those is the way investors are thinking. You know, if you're an investor today and you're thinking about investing in a new software company or a drug company or a device company, you're much more likely to ask, how is this new technology going to make healthcare more cost effective, because you know that's going to be a market expectation. And so that the investors are, and their expectations are, a connective tissue. Another one is the flip side of that, a different kind of investor, if you will, which is the big companies, which are often the ones who acquire these newly emerging technologies from the startup companies and so forth. They're asking these kinds of questions too. Another kind of connective tissue that's interesting is a lot of people don't realize that the strongest concentration of comparative effectiveness researchers in the United States is in Seattle. Between the UW and the Hutch and Group Health, we have a lot of these wizards in our midst, and they're very knowledgeable, very well respected, and what's extremely encouraging, they're interested in being helpful. So as you formulate a new project, a new technology, and you're trying to think about how am I going to really genuinely assess its impact on health and health economics, these wizards can really be helpful, and they're more evident now locally.
Not hard to imagine why comparative effectiveness is becoming increasingly relevant. Can you give us some examples of things that we're learning from these folks that we can almost take away and think about in terms of direct application to healthcare and even healthcare policy?
Well, the effectiveness researchers, they're experts at measuring what really happens in the real world, and how does the new method compare to the old method and that sort of stuff. But the sweet examples are the innovators who are going into that kind of climate and subjecting their ideas to that kind of measurement. And so you find not just new technologies to address a patient need, but new technologies, new ideas to address a healthcare provider need, to take out some of the waste, to make things more streamlined, to make patient outcomes more successful. I just had a conversation with a fascinating app developer who's got a very, very thoughtful iPad-based application to help patients from when they first contemplate knee replacement surgery all the way through rehab, it turns out patient engagement with their care is critical to success. And this is a thoughtfully constructed aid to that.
Yeah, it feels like we're just on the cusp of learning a lot more about the role of the patient himself or herself in the regimen of health. One last question about just the feeling of the place. It seems to me that this conference grows in size, obviously, but it doesn't just grow in size by having more of the same type of people. It's growing in heterogeneity as well. Is that your sense?
I think so, and I would expect that would be a very important characteristic in the subsequent years, because the contributors to life sciences innovation, which is what this is about, the sphere of contributors is broadening, all right? I mean, for the classic example that I use is, there's a reason that the Cleveland Clinic has 40 industrial engineers on staff, right? It's because life sciences healthcare innovation involves a lot of different talents. It's not just about new widgets. It's very much widgets and drugs, but it's also all these other things. And I think there's a huge benefit in putting that greater community together in an event like this. It's very exciting.
Sometime we might even find a sociologist or two around.
We could use a few of those. Absolutely.
Lee, thanks for your time and your insights. Always a pleasure.
My pleasure.